With the amount of medical calls Murfreesboro Fire Rescue Department go on throughout the year, a high number of them will include cardiopulmonary resuscitation, or CPR.
This month, we've been conducting our annual, which is biannual, really. We have to do this every 2 years as a CPR renewal. This is done through the American Heart Association's guidelines. We have several instructors on every one of our shifts, so some of the guys that will be leading the instruction today that you're going to see, they are certified through the American Heart. We have those guys going from station to station. We're still following the COVID guideline stuff, so we're trying to keep our numbers restricted down. They will go through and watch video, and then they will get up and do some hands-on stuff at the end, and then we kind of ramp it up at the end and kind of make it a little more Murfreesboro style, to where we'll give them a situation or a scenario that they're going to be going into a house like they would as a crew. They will work as a group together, come in, and they will kind of go through the entire steps from start to finish, to where we actually do the handoff to the ambulance crew at that point in time with this. They're going to come in and use the heart monitor on the monitors that we actually carry, and they will look at 12 different views of the heart. Because, you know, depending on where the heart attack actually occurs, if you only see it in one lead, you could miss that. We are going to go forward to where we're going to be able to transmit this information directly to St. Thomas Rutherford. So with them going into the hospital, they're going to know ahead of time that that patient's actually having a heart attack, and hopefully it's going to minimize the muscle and stuff that's actually injured during that heart attack. The training you'll see our guys doing, they'll be using a bag valve mask, to where we actually don't make any direct contact with skin. When they do their scenarios, they're going to provide the care just like they would be doing it on a real person, to where they're going to drop an advanced airway. The monitors that we carry on the apparatus, they have live feedback for CPR. It tells us the rate, the depth, and all this stuff. That's how we can gauge if we're doing, you know, the best CPR that we possibly can. It's going to show them how fast or how many they're doing, because American Heart recommends between 100 and 120. You know, it used to be 80 to 100, and it's really an opportunity for our folks to be able to work with some of the equipment that they're carrying that maybe they don't get to use a whole lot.
The level of care the Murfreesboro Fire Rescue provides is EMR, Emergency Medical Responder, AEMT, Advanced Emergency Medical Technician, EMT, Emergency Medical Technician, and the highest level, Paramedic. Every new hire has 3 to 4 years to be licensed as an AEMT.
We would eventually like to have a paramedic on every one of the apparatus. You know, that's not demeaning what the AEMT does. But if we had that, then we're going to kind of have that same care all the way across the city. That way we can provide that highest level on every call that we do go to. This is patient-driven. I mean, that's why we do this, is because we want to help. We've got people here. Our stations are strategically located to where we can be at about any resident inside the city in less than 4 minutes. Somebody having a heart attack, you know, every minute is muscle as far as when that damage to the heart and things like that. So by having our people in these strategic areas to cut that response time down, that is our goal. Is, you know, we can get the advanced care to the people, we can prevent it from going any further, is what the goal would be.